So
Okay.
I'm with Priscilla Romans, the founder and CEO of Graith Care. And I did say Graith correctly, right? You were telling me just off camera beforehand what that means. I'd love for you to share that with the folks here.
Yeah, so Graith Care, the word Graith is actually my two girls' names, Grace and Faith, put together.
Nice.
And Graith means to make ready. And that is, it's such a great thing for advocacy in terms of what Graith Care is all about. And so to make ready is to really listen to our clients and find out what do they need and how do we figure out how to provide them solutions and options that they're maybe not aware of. So my husband, he's the one who put the word together because I'm not that creative.
Well, when you guys were sitting down and you're knowing, hey, and we'll tell the origin story of Graith Care, but like when you're sitting down and coming up with a name, is it a piece of paper with a bunch of stuff written, or did it just pop into your husband's head, or like how did you guys end up with this name?
I told him just figure out the name and I'll figure out how to put the business together and do that.
Yeah.
And
when you heard Graith, though, did you go, oh, I love it?
I love it.
Okay,
I
cool.
knew it right then because I had tried a lot of different other names in my head for a while, and finally I just said I can't even think of a name like this. This isn't me. And so he's super creative. And so he just thought of the name and he said, we're just going to put the girls' names together, Grace and Faith. Now we have boys, so I try not to leave them out of it. Gabe, he set up my Twitter account. He's 16. And then Elijah, he's 8. And he just makes sure that mom has like everything she would possibly need for her day. He'll bring me things. If I'm on a call or anything like that, he knows. He'll write me notes.
Yeah, there you go.
So, I mean,
and which
we're
one did
team.
you steal the microphone from for when you were
the 16-year-old. I
okay.
stole the microphone because we do have a Rumble channel for Graith Care that I'm trying to do like 2-minute clips, trying to just get little bits of information out to people. I'm not a podcaster. I don't do any of that stuff. I don't even like wearing makeup, to be honest. So this is a family business. I grew up in a family of entrepreneurs. They were either family entrepreneurs, ministers, or nurses in our family. That's the general concept of how I grew up. So we woke up, we got to work, we figure out how do we go help people.
That's right. Well, so there's not going to be any question of what your why is or why you got into this calling. And patient advocacy is the right category for us to position this. So I want to talk about, before we get into the solution set that Graith Care offers and what you do and what you clearly are very passionate about. So it's clear that you don't have to kind of drum it up just for the sake of telling the story. But can I hear a little bit of your backstory first? Like, where'd you grow up? Who are you kind of personally and professionally? And then I know I want to spend some time talking about your nursing career as well. So tell me where this all started.
So I was born and raised in Peoria, Illinois. And lots of cornfields, small town girl, very conservative. I grew up actually. I think I put my first pair of jeans on. I was maybe 18 or 19 at my friend's house.
Okay.
So if that tells anything about me.
Did you feel rebellious when you did that?
I was very rebellious. Everybody says, oh, you're a PK, a preacher's kid.
Preacher's kid,
that kind of raises flags for people. I promise I wasn't that bad.
The preacher's kid said that the suggestion is you might be a little bit wild, right? As a preacher's kid,
Yeah.
But you went the other direction, it sounds like.
Well, I think I did have probably some streaks in my life. So if people look me up, I'm sure there could be some interesting things about me. But really, if we're thinking about, the reality, everybody has stuff in their life, right? And that's just how I grew up. And I had great parents that something I love about my family that I think made me who I am today is my grandparents, my grandma and grandpa on my mom's side. He fought in the Battle of the Bulge. He got shot and wounded.
No kidding.
And he came back to America, and they flew him into Colorado Springs, and that's where he met my grandmother. She was a lieutenant nurse in the Red Cross. Okay. And so after 6 weeks of her...
Was she treating him, taking care of him?
She was taking care of him. After 6 weeks, she would make him get up and sweep the floors. That was his rehab. I mean, this is old school nursing.
Oh, I love it.
And so, they got married. They were married 62 years. And I think about the battle that they were in at that time. And I think about we are in a different type of battle right now within the healthcare system. And so that kind of sinks really deep in me. And then on my dad's side, my grandfather and grandma, they actually started a bicycle shop close to the University of Illinois. Okay. And every summer, I would go to the bike shop and I would sell bikes. The university students would come and rent bikes. We would be putting bikes together.
So you got into, that's where you kind of learned sales, I guess, a little bit?
Entrepreneurship. I mean, my grandma, she was, I don't know, she's probably up to 90, still going to the bike shop with her purse and her walker. And she would show up, and she believed in hard work.
Love it.
And so those fundamentals, I think I didn't realize when I was younger how great they were, because I really didn't understand what was happening. Even my parents, I mean, my dad's a minister. My mom's a nurse. She worked in the healthcare system for a long time. I heard their conversations. But when you are younger and you go to the hospitals and your dad's praying with somebody and you're outside the room, and you don't really realize what's happening, but those things just kind of settled on me to understand how we need to connect with people. What is the bigger picture of how do we help people moving forward? And then we unravel, we moved from Illinois to Texas in 2017.
What was the impetus for that?
My husband's job. He's an engineer.
He's an engineer. Okay.
Yeah, he's an engineer background. Now,
wait, he's a creative engineer though? You told me earlier he's
yes,
creative. Those don't go together. Okay.
He's totally different.
Okay.
I think I married a winner. We're coming up on 18 years. I hope I said that right in February. But we just had we've been together 21 years actually this week on the 14th. Our first date was supposed to be on the actual 9/11. Well, we canceled it because of that whole event.
Sure.
And we moved it to the 14th, and somehow we've made it this far. So
my wife and I don't have quite as traumatic of a reason for changing ours, but we had the anniversary of our first date. We at 520, and we tried to book for the wedding on our campus at Drury University, which is in Springfield, Missouri. And the chapel wasn't available on the 20th, even though we booked it out like 12 months. And so we had to do the 28th. So we still celebrate the 20th, but the 28th is technically our anniversary. So again, not quite as a big event as that, but yeah, so we're similar story there. So you said 21 years, though? Did I get my math right?
Yeah, we've been together that long. We actually, if you really want to know, we actually met each other in first grade.
No kidding.
We both got held back in the same first grade again, and then he moved away. We ran into each other in a community college in Illinois, and he said, I remember a gal named Priscilla. She wore lots of skirts and dresses, and I'm like,
that was me.
I think that was me. And
isn't that wild, though?
It's
what
so
a
wild.
serendipitous thing.
It's so wild. And so we started out in Illinois. We have 4 kids. Gabe is 16. Grace is almost 15 coming up. Elijah's 8 and Faith is 6.
And how did they do with a move? Because that's a pretty big move.
Oh, they
right?
did great.
They did.
Our kids
were
are
they
amazing.
Excited to come to Texas or what?
I don't know. We just packed it up
because did it. Okay.
Well, I mean, at that stage in 2017. There was a lot of engineering jobs that was going back overseas. Mitsubishi Motors was one of them, and he was doing some engineering work for them. Well, when they closed their plant and then went back to Japan and all the other engineering jobs, contracting jobs in the engineering world can fluctuate, right? Okay. And so he got an opportunity down here in the Dallas area. He said he was unemployed at that point, and we were just working off of my nursing income. There wasn't anything that was popping up. I lived a mile down from my parents. I had never moved anywhere else. I was in a bubble.
Wow.
Okay. Wow. I had worked at that point.
I should ask the question, how did you do with the move then instead? If you left your bubble for the first time?
Well, I actually think it was probably a God sent thing because I had worked in one healthcare system there in Illinois. Okay. It was a very large healthcare system. At that point, I was 18 years in. I even, had a pension from them. I mean, pensions are very, so it was a great healthcare system to work in. Great. I mean, I learned a lot, but I didn't realize what was also happening. And when we moved down here in 2017, and I got picked up by a large insurance company. I did some work for them in terms of the population health approach, holistic, those type of things. That quite wasn't a good fit, so I decided, I'm going to try something else, and got picked up to try to do some government work for waste, fraud, and abuse. I helped run 29 state Medicaid programs for state governments. And that really opened...
Did you uncover a lot of fraud, waste, and abuse during that time?
It's crazy. I didn't even know this stuff was existing.
Yeah.
I just had an operations background, so I understood from an operations standpoint how to cut money, how to... And my nursing background from the bedside really helped me understand, other criteria that we really need to also look at for waste, fraud, and abuse. So it kind of made sense. It was a job. And
did it give you a little bit more of a jaded view of the healthcare system after seeing all the fraud, waste, and abuse, or no? Okay.
No, not really. I think I just questioned everything. I just questioned things like, well, that doesn't make sense. Like it just, all these different things just didn't make sense to me. Even at the bedside, I was questioning things like, well, why wouldn't we do that? Why wouldn't we tell the family that? I mean, and I'm just such a transparent person, but when you're kind of locked in certain industries, I mean, you do have to follow their policies and procedures. And, I don't know, it's just.
Well, you're operating within a system, right? And you're one person within a system, and things don't make sense sometimes if you're looking at it from like a humanistic point of view or, a service point of view. But hey, maybe there's a financial reason why this is done.
Right.
Maybe there's a legal reason why we have to do this, or we're worried about getting sued, right? So like on the surface, you go, why is that happening?
Yeah.
But that entity or that business is probably protecting itself against other things that could happen. But from a human point of view, you're going, well, this doesn't, I'm doing this to a person, or I'm not giving them the best ideas, or so did you find, like, I know we were talking about, and I want to share this on camera too, where you were talking about people started coming to you, but did you find a point where you started questioning enough of the things yourself that you thought maybe you needed to just go out on your own, or did the market pull you out?
Well, it was a little bit of both. So in 2019, I probably the last handful of the months of the year, I just was struggling. I was really struggling in my corporate job, just not really satisfied and frustrated because I felt like there was a bigger calling for me. So I just wake up, I just didn't know what to do with it. And so I started writing down thoughts in terms of, okay, this is what I know, this is what I'm struggling with. And people would always call me, my friends, family, people that I knew, they would call and say, hey, Priscilla, what do I do with this situation? And I would say, hey, try these next couple things. Call me back if you need more help. That's it. That's all I do. And then I started getting phone calls in February and March of 2020 saying, hey, Priscilla, this is happening. And then I started getting calls from people I didn't even know. And I was like, oh, this is
Was
getting.
somebody referring you?
Yeah.
Okay.
I mean, people that I had helped, they would say, hey, they gave me your name. They said you would be able to help me. And I'm like, well, okay, yeah, I can help you, but all right. And I was like, this is getting weird. Like, I've got 4 kids. I'm working.
You basically were an unpaid consultant at that
yes.
place. Yeah.
And so finally my husband got frustrated. He's like, like we got to pay bills. We got to catch up from all the, I mean, it's a lot. And so we launched Graith Care in March of 2020, and we just started figuring out what does this look like? What did the market really need? What were the questions people were asking? And at that point, that's when the pandemic was really hitting hard and starting to question. Schools were being locked down, the hospitalizations, some of the COVID-19 protocols that people do talk about. All of those things started raising questions. And then we started getting more and more calls. And I only had my cell phone number out there. And then I was like, I think I need a business number and I need a website.
And email and all that. This podcast is brought to you by True Captive Insurance, a premier medical stop-loss captive for employer groups ranging from 25 to 1,000 employees. True Captive believes in healthcare that is personal and insurance that isn't complicated. That's why they take a white glove approach, making it easy for employer groups to transition into a program built specifically for them. Check them out at truecaptive.com. Well, but so pre-pandemic, right? Because you did say you started March of 2020, which is, we all know, that was literally when the shutdowns happened.
Yeah.
Let's do pre and post-pandemic. Pre-pandemic, what type of things were you solving for people at that time when they were coming to you sort of proactively and you were doing this sort of voluntary service to them?
Just typical transition of care, like questions about maybe insurance, how to maybe make sure things get submitted correctly. Sometimes the doctor writes the wrong type of order. Well, if they write the wrong type of order, it's not going to get covered because of medical necessity. Okay. So very basic things like that. In my mind, it's basic, but to the layperson, it's like they keep denying me, or
and I have no idea why.
I have no idea why. I'm in this appeals process. Now, I don't know all the rules with insurance. I just know enough to figure it out. That's kind of my mentality in life. Like, okay, well, we got a problem. Let's figure it out. Let's see. People not understanding maybe immune support, basic things in terms of their immunity that they really need to boost up, right? Let's try to do more preventative things. You know, let's stop reacting to issues. It's a lot cheaper on that end of it. So those type of things, transition of cares from the hospital to the home. There's a lot of gaps in that. And that's why there's a high readmission rate. Because when they are discharged from the hospital home, things are forgotten. On the discharge.
Because you get a sheet of paper and it's like, do these things, but like some people don't read it.
No,
you forget where
they
you
don't
placed
read it.
Or I put it in my purse, or I threw it away on accident, or something like that, right? And so maybe there's some very important instructions, but all you're left with is sort of this printed piece of paper, right?
Yeah.
So when did you discover though that I could actually charge people for this? Like, was there an initial step where like you had to come up with, here, what is my hourly rate, or what do I do? Like, I mean, because right, it's one thing just to help people out, but it's another thing when you go and actually establish an official business, you've got to come with, well, what is the market rate for this type of service, right? So walk me through some of that, like evaluation process.
That was so hard. That was one of the most challenging things that I came across because I just want to help people. And asking for money, like any nurse in America, none of us ever asked for money. We're like, we just want to help you. Well, I've got a family of 6, and I knew that I needed to step out of my corporate job, and I know I need to be able to sustain this. And if I knew that I needed to grow this enough where I needed to bring on a team of advocates, I need to pay them.
Sure.
So there's a cost with that. So I started out with just figuring out what that was. Our initial clients, I went back to them and I said, hey, tell me, what did you think about this experience? Was it worth what you paid? And client after client was like, I would have paid a lot more for this. And I was like, really?
Yeah.
And they're like, yeah, you have no clue. I've been dealing with this for a decade.
Oh, geez.
And they said, do you know how much money I've spent on trying to figure this out?
Yeah.
It shocked me. I was like, really? They're like, yeah, like the specialty visits that I was going to. Do you know how much that cost me over time? There was no reason for me to go to all those specialty visits. They all told me the same thing. I had to go get all these procedures done. I was on all these pharmaceuticals. Some of the pharmaceuticals made me very sick because of their adverse reactions. I mean, and then I helped. I mean, we don't, with Graith Care, one thing that your audience needs to know is we don't prescribe because we're not licensed to do so, and we do not diagnose. All I'm doing is advocating. I'm saying, hey, okay, you've been going through that. Let's think about this a different way.
And so let's actually define what you believe advocacy to be, or the role that you provide. So when we say advocacy, who we're advocating for the patient, for the person, but how are we advocating on their behalf?
Yeah. So we're an independent advocacy group. So meaning we don't work for any hospital, any insurance company. Okay. We only work for the people that hire us. So we're very independent. So that means we take off of our blinders of those policies and procedures because they don't hold us back from saying certain things. We want people to know the truth. So that really helps us open up some of those conversations, right? So that's number one. Our scope of services are very well defined. Okay. Patient advocacy, recommendations, consultations, and advice. We don't do anything but that. All of the information that we're talking about is deemed opinion only. Right? So I'm giving my opinion based off of my experience and letting you know, here's what I really think's happening.
And here's some options.
Here's some options.
So, but you have to stop short at telling them what to do, right? Or
I never want to tell them what to do because the patient should be in control. If they are truly informed and have informed consent and they know all of their options, they get to make the best decision for them. That's why I never have to mandate anybody. That's why we should never have to mandate anybody to begin with. Yeah. Because if they know, then they can make the best decision for them.
We've spoken about this on the podcast in the past in different contexts, but some employers, especially when we talk about like group insurance, take a very paternalistic approach and they want to tell people what to do. And I know these systems also sort of have guardrails that dictate what a person can do. But my belief, and I think you shared, is that if an individual is appropriately informed of what their options are, that they more often than not will make the best decision in their own interest, but also that would trickle up in the employer's best interest probably as well if they're on some sort of group plan. But right now it's difficult for an individual to know what to do, right? I'm in this industry. I still struggle with, direction or care coordination or knowing even where to go in the first place when you have an ailment, right? Because it's such a complicated system. So I can see why there's a need for advocacy. Was there a model that existed prior to what you're doing that you sort of replicated, or at least had the idea of, oh, I think I'm going to do that thing? Like, or is this almost you're building the plane as you're flying it at the same time?
We're building it as we go, because I don't really like to look at other models particularly, because maybe it's just my personality. I just like to do my thing. Like, I don't want to copy anybody. And I think there is such a great momentum behind advocacy at this moment in time. You know, here we're 2.5 years into this pandemic, and people are now really asking even more questions than we saw 2.5 years ago. And it is really awesome to see people really wanting to engage in their healthcare, get better, and not be dependent on a broken system, right? Yep. So there's a codependency issue that we have. They go, oh, I've got insurance, I've got that. I mean, it makes people feel better, like this peace of mind. And I'm like, look, it's great you have insurance, but if you don't engage in your healthcare and be proactive, you're still going to be paying a lot of money. Well,
here's the misdirection with that. One, you got billboards with people smiling, holding up their insurance card, right? Like, it's like, how happy am I that I'm covered by you know who? The other thing is that we've directed people's decision-making process around everything goes through insurance.
That's right.
The issue is insurance wasn't originally designed to be the thing that you swipe when you just go see your doctor once, right? Like, we've now convinced everybody that the entire spectrum of care is supposed to be run through insurance, when really insurance is supposed to be there if something catastrophic or something major happens. So now all of these claims, everything rolls under the umbrella of insurance, and that's why you continue to see premiums go up, or one of the reasons, of course. We were talking about direct primary care off camera. Why I like that model is you just take that out, you set it over here, it's now a fixed cost, it's not running through insurance, and now you're emphasizing the quality of care and the time spent with the patient, and not just funneling through a system and, you know, scanning codes and, you know, billing for certain procedures and things like that. So where I was going with that, I almost lost my train of thought, but like you get me excited, and sometimes I go off on tangents. But I want to come back to the Graith Care solution in terms of like practical application of this. So how does a person get engaged with Graith Care in the first place?
Super simple. And I like simple because I'm not a very complex person. My husband might not agree with that statement, or my 16-year-old. But somebody that needs an advocate that is just specific to their need, what they do is they either call us direct. Our number is on our website. They can go to the Graith Care website, okay? When they go to the Graith Care website, they want to look for the Enroll Now button. Once they click Enroll Now, they just put in their name, their number, and then they select what type of advocacy service they're looking for. There's over 40 plus options on there. So some people will pick, I need help with my insurance. I need help with my bills. I need help with appeals. I'm looking for a transplant advocate that understands transplants. That's a very complex need. I'm looking for holistic alternative options. So we have all these different needs. I need something for my kid, pediatrics to adults. So people come to us and they select those things. Our intake specialist will call them, screen them to make sure we give them the best fit advocate for their need, because we have over 20 plus advocates in the U.S. and we have an international based advocate as well.
Do you really now? Okay,
yeah, we do.
Very cool.
So we've got clients right now on our panel from Australia, Greece, and Canada. We've gotten calls from Spain and South Africa as well. Here in the last, it's crazy.
How did somebody in South Africa find Graith Care?
I don't know.
Are you just Googling, and maybe SEOs working on finding advocacy or something?
But, I have no clue. I mean, people are picking up the concept. So, you know, I think people are just sharing. They're excited about it because they're like, oh, this is such a good concept. I can have somebody actually tell me the truth, and they're going to give you everything based off of their experience, or they're going to go figure things out. Because I'll tell you, people call me with the strangest things I've ever heard of, and my comment back to them said, look, I don't know that answer exactly, but I've got a really good network. Let me go see what I can figure out. So do you have an
example of something really strange that somebody that you can share, I guess?
Well, there's some really difficult situations that we get. So these hospital cases, so this is a very real thing that's happening to people, and the critical nature of it. So people are going into the hospital. They are still getting sick and diagnosed with COVID.
Sure.
Okay. It is a respiratory illness that can really take down a system. However, what is happening is, even if they go into the hospital, They get screened with a PCR test that has a lot of false positives. They get screened and diagnosed, have a COVID-19 diagnosis on deck, okay? Their primary issue, let's say a GI issue like colitis.
That's what they came for.
That's what they came in for.
Yeah.
But they want to swab the person. They get diagnosed with that. And then they go, oh, COVID, we need to start that protocol. They totally neglect and forget about the initial primary reason the person came to the hospital.
Right.
Because they got a shiny light of COVID-19, because hospitals still are being incentivized for these protocols. It is hard for our healthcare community to really swallow that pill, because why would we incentivize, right, to give some of these things that really are not great in nature?
Yeah.
They're not.
Well, and do you think we will relinquish that incentive to them, right? Because it sounds like it's still ongoing, right? Although I think most people, if you look around, would suggest that the pandemic is over, right? Or at least
they're telling us it's over.
Being inundated with it, right? And so this is where I can see where we could get, we got to be a little bit careful, right? Because the overlords won't like what we talk about. But what I will say though is, to your point, that's a pretty frustrating scenario to hear about, because if I come in and I've got a pain in my stomach and I know something's really serious wrong, maybe I have a history of that, and all of a sudden you pivot over to this because you screened me for it and you got a positive, whether it's a false or a true positive, whatever. And that's what you focus on instead, because there's maybe a financial incentive to do so.
Right.
Where does the care of the individual come in? Right?
So what we're doing is we're working with that family or that patient if they're competent, right? We do have some elderly people that have a healthcare power of attorney that we work with to help guide them and empower them through the process. Here's some questions you need to ask the doctor. We need to start planning for a safe discharge. Do we need home health? Do we need, what are the things that we need to be starting to set up, right? Because those case managers on the floor, they're super busy with a whole lot of other discharge planning, right?
Yeah.
They're not independent to that person. Plus, at the same time, what are we doing for that person's immune system? Right? What are we doing to make sure that the doctor maybe wrote all the right orders and didn't forget about a test, and they're waiting a full another day for the doctor to come back and do rounds? These are real things that are happening. Why do we need to have another inpatient stay when we can make things happen today?
Yeah. Yep.
So these are the things
like
we
a
need
second set of eyes almost, but an independent second set of eyes, like reviewing everything that's going on. This podcast is sponsored by PlanSight. PlanSight is a technology for employee benefits brokers to more efficiently manage their RFP process for any group size, all funding types, and over 20 benefit lines and point solutions. PlanSight is the only end-to-end RFP technology on the market today. Let's modernize your RFP process together. Check us out at plansight.com. Now, you guys, haven't you helped with people getting changing locations, right? I think I saw a story. Was it is it Epoch? How do you say Epoch or Epoch Times? Like there's
Epic Times, Epoch Times. I've heard both.
I've heard both as well.
Yeah.
EPOCH. But I think within that article, it talked about some of you helping individuals transfer from a certain situation where they felt sort of stuck, and you got them a new location to be treated. So elaborate. That's all I very basically remember.
I mean, these people were in the hospitals for COVID-19. They were frustrated with what the doctor was telling them. The only solution the doctor had, when in some situations they'll just say, well, we just need to intubate you. We need to intubate you. They said, I don't want to be intubated.
Yeah.
I want these protocols. There is a frontline doctor's protocol that is on the online that people do know about. And when these patients go to ask for this, they'll go, well, doctor, I want to try these things. These doctors will go, I can't. It's not part of our policy and procedures. We don't do IV ascorbic acid, which is vitamin C. We don't do, methylprednisone. We only do Decadron. We don't do ivermectin. These are real things that people are asking. So they come to us and say, can you help us with that? And we say, well, let's talk to your doctor first. We literally have a conversation with the ICU doctor.
So you are talking to them on their behalf, okay?
Yeah, because that's why we have specific advocates that understand the language of the critical care. So I have a background in critical care. And so having these conversations, or my other critical care advocates, we need to understand, why are they on BiPAP? Why are they on these type of things? What are we doing for their nutrition? Is their albumin tanking, their malnutrition? These are things that we need to be asking. That's why we have certain backgrounds for specific needs, right? A layperson isn't going to know these things.
But you can help that individual in that situation where they're not getting what they're asking for, right? Yeah. They don't feel they're getting the right treatment and or they're being limited in what treatment they're allowed to pursue. And so you say, hey, well, we've reached an impasse with this situation. Let's get you somewhere else. So like, how do you assist with that transfer?
Well, one, we have to really collaborate with these physicians. We need that physician to write an order. In order for the physician in the hospital that would accept, we have to have an accepting order. Okay. In order for that patient to show up to the next hospital, because in some of these situations, we have to go look for an air ambulance, maybe a bariatric plane. If they meet certain, we've got to know how tall, how much do they weigh. Wow. We've got to understand costs. We understand negotiations with these things. We understand can they fly. Because maybe they're too critical. Maybe they're on too many pressors that are sustaining their blood pressure, or their kidneys are starting to fail. Have we lost that window of time? There is certain patients that you cannot fly. It's too dangerous. Okay. So we have a window of time that we have to operate in. And when you work in critical care, you've got to understand these things.
You're like a logistics expert on top of all these things, right?
It's amazing. It's so much fun. I enjoy it.
Well, so speaking of fun, do you have like a specific success story or one of your favorite things you've been able to do in the last couple of years for people?
Yeah, just people can go to our Rumble story, our Rumble channel, Graith Care, look up Molly and Jim.
Molly and Jim. Okay, Molly and Jim on what is your Rumble channel or
it's just Graith Care. Okay. It's a channel. People and subscribe.
And subscribe, yes,
because we're growing it. Yeah. And I put 2-minute tips out there on different topics and things that people are asking, so people can start to really engage and ask these questions. So Molly and Jim, they of course gave us permission to talk about their story. I wouldn't talk about anybody's private information without that consent. But they were in South Dakota. And they were in a very high tertiary type, the highest healthcare system in that area.
They weren't in Spearfish, were they?
What?
Spearfish?
No, it was a hospital system. I will just do that. I don't want to probably
fair enough. Fair enough. Anyway, I just
had a friend it was the top tier because the reason literally the ICU doctor goes when I said, well, doctor, here's what they would like. Are you willing to do this? And he goes, well, no, we just don't do that here. Nobody's gotten that here. And I had the nurse in the room too, the bedside nurse, and the nurse goes, if you fly him out of here, he's going to die. I said, well, if we don't fly him out of here, he might die too. Yeah. And she was a little bit upset that this was even being presented. Like how, he goes, nobody has flown out of this hospital. He goes, we are the highest tier hospital in this. We have 300 hospitals connected to our system. I said, yeah, I know. I said, I'm aware. I'm well aware. I said, but this is what they want. It's a patient option. Yeah. And they should have that in information so they can make the decision. And we weren't upset with that physician. We just knew he was capped as to what he could or could not do. Right.
So we have to separate the individual from the system that they operate in sometimes, right?
That's
they have other pressures that are outside of their control, right? And even things down to their license or their employment, right? So like you have to almost it's like to separate the art from the artist sometimes. You have to separate the doctor from the system as well. And I think that's fair to like give them a little bit of grace as well. But so also if I'm a doctor in that situation, I might say, okay, well, I know I can't do this. These are my constraints. Yeah. Let me see if I can help this patient get what they need.
And he did.
Yeah, good. Okay.
And that physician, now we have had physicians refuse to write the order that I was asking just to see if we could get the patient approved, because that other accepting physician has to read the medical records in order to say, yes, I accept this patient to come to our hospital, right? Okay. Because it's an inpatient transfer, inpatient bed to inpatient bed. Okay. They don't come through the emergency room. They go right to the bed. Okay. That's how this works.
That's how it works. Okay. And so in the situation that they refuse, is there a legal pressure that has to be applied?
Oh yes. Okay. Yeah, we just recently had one. Okay. That story hopefully will be coming out. I would highly recommend that people follow Graith Care because they're going to want to know about this story.
Okay, interesting.
And unfortunately, this physician did the wrong thing. She was claiming there was a safety risk in flying. Well, when you understand that you're working with the best critical care teams that do air ambulance that are credentialed in America and in Europe, there is no safety concerns. If they say yes with their medical director that they can fly him safely, then we do it.
Then you do it, yeah.
Because if the patient wants that, they should definitely get that right, because this physician was not doing the right level of care. She was ignoring what the patient need actually was. Mm-hmm. Mm-hmm. And that patient did not survive because she ignored what was actually happening to that patient. She ignored.
Yeah.
And we did everything. This was a last-ditch effort to try to save him. And I'm telling you, when you're dealing with the wife and the family, and they've had other family members die because they didn't get good early treatment as well, I'm telling you, this is a crisis.
Yeah. Well, one, I appreciate your passion, right? Because this does need a fighter, if you will. It needs somebody that's out there, one is explaining what can be done, showing the options, but actually means it, right?
Yeah.
Like it's one thing to, oh, this is my profession. It's another thing with there's a bigger, like you said, you're kind of almost called to do this. And so it's very clear that you believe strongly in what you're doing. But what this comes down to is helping an individual or individuals in a moment of crisis, right? Being a vanguard for them, right, at the end of the day, which most people don't have or even don't even know where to go. And how are most people finding you nowadays, right? I realize you're a couple years into it and obviously you have success stories and you're getting this brand awareness. Is it organic traffic now or is it still a lot of referrals? How are you finding?
It's both still. I mean, we are starting to really work with other type of influencers that really love what we're doing. So they want to share Graith Care. We said, great, share away, have fun. And that's what this is about. It's really uniting people and bringing those solutions. Physicians are calling saying, hey, I've got some people that I really think they need an advocate. I only know this part of it, but it sounds like you're able to find these other solutions. Can you help them with these things? Yeah, we can.
Cool.
We absolutely can because we got to come together.
Are you expanding like kind of your core services
our network is amazing.
Yeah.
It's amazing.
Well, it's funny that you seems like, it's on one hand you go, well, if I started in March of 2020, that's like the worst time in the world to start a business. But the other hand is probably that was the perfect time for this to start because what you were doing over the course of the last 2 years, right?
I mean, again, I'm a preacher's kid and God has timing. With everything. Yeah. And I always believe it's the right time. Well, I've ruffled I've argued with God about things going, I don't know how to help this situation. This one is way beyond what I ever thought we were ever going to get. I didn't know this was going to happen. I didn't know mandates were going to be happening to people and people having to make a decision about something they were not for sure about. We've had to help these people because, again, there should be informed consent. There should be a question about what is safe, what is effective, what does that really mean?
Or even just room for asking the questions in the first place, which is a bizarre thing. And you mentioned influencers before, and I don't consider myself that at all, but I am excited to introduce you to the audience that does follow this podcast. But you've also got introduced, you were telling me earlier, you got introduced to the TikTok audience in a very brief, very viral fashion, and then boom, it was gone. So can you share that story? Because I don't see you as a controversial person at all, but for some reason somebody thought that was the case. And so I would love for you to share that story with the audience really quick.
So about maybe a month and a half ago, I got a phone call and they said, hey, Priscilla, you're on TikTok. And I said, I don't have
Not me, yeah.
I don't have a TikTok account. And my kids might have a TikTok account, but I don't. I said, what's going on? I said, can you send it to me? She goes, yeah. So I watched it. I was like, oh, that's a good clip. I was like, that was really good. I talked about the real cost of healthcare. Yeah. I talked about cash price, negotiations, just very quick. It was like 30 seconds. I had done a Jonathan Otto is a film maker. He's a humanitarian, and he did this Unbreakable series where Dr. Peter McCullough, Judy Mikovits, some of the big names out in the community, people are on. And here Priscilla is the last little part of the Unbreakable series talking about Graith Care and advocacy and helping people. And he chopped up a couple of clips. Well, this one clip, when I had watched it, it had over 650,000 views. It was like 3 or 4 days into it. Wow. I was like, wow, that's amazing. That's never happened. This is crazy. I had my 16-year-old and 14-year-old. I sent to them. I said, hey, check this out. Is this legit?
Mom's viral.
And Grace yells down the stairs and goes, Mom, I think you went viral. Yeah. And I said, oh, that's cool. Well, like 2 days after that, I had put it on my social media because I thought, oh, great, I want other people to see this. I started getting messages, Priscilla, it's not on. Yeah. It's not on. I was like, that's weird. So I went and looked myself and I'm like, that's weird. It's not on anymore. Huh. So I contacted Jonathan. I said, hey, that TikTok, it's not there anymore. He went and looked at his account. He goes, my account was taken down.
Like just complete takedown of the account.
Takedown of his account.
what did he have? Do you know if he had like warnings prior?
He's had. I didn't know about. He said his account has always been fine.
In good standing,
yeah. Never had an issue.
So that one single event took his account down?
That's what he was saying.
Man, I wonder if he's been able to speak with anybody, because that's always the weird thing. I had this weird thing where I had a strike on a YouTube video because there was a link to one of my guest website, but for whatever reason, I guess there was some malware on the site, and YouTube's like, oh, warning, you got a link to this external dangerous site. I'm like, what? It's his reporting site. Like,
We're on a mission to partner with the most innovative companies in America to fix health benefits, one plan at a time. NavMD has created a blueprint that delivers world-class benefits to 155 million Americans. Better benefits starts with data intelligence. Our platform is empowering the next generation of advisors to zero in on opportunities to optimize the plan, build the right team, implement proven strategies and solutions. Join us on our journey to revolutionize health benefits. Let NavMD put you a step ahead.
But anyway, so like some of those things are probably just, their AI detecting something and then you just solve for it. But this sounds like he didn't even have an opportunity to dispute it.
I don't know. I mean, I kind of thought it was exciting too, because I was like, that's amazing. People are starting. And I literally have I captured screenshots of people sending me because they saw that video.
Yeah.
They literally called and said, I went to my doctor's office, and instead of me giving my insurance card to him, I asked them what the cash price was.
Yeah.
I said, good for you. Good for you.
Awesome.
Because I need people to know this information. They should understand what the real cost is. Then they can make a decision.
Yeah.
I'm not against insurance.
Well, what do you think, if you had to speculate, what was the thing that was, violation of terms of service on TikTok?
I was really tired that day, so maybe I had really baggy eyes or something.
Yeah.
But
just the way, at least what you described, nothing sounds quote unquote controversial.
No, I didn't think it was controversial at all. But clearly something must have ramped it up, because people started, even with those messages, I was excited. I was like, people are getting it.
Yeah.
They're understanding that they can be in more control, in the driver's seat of their health care, and we, as an advocacy group, are just filling them up with information.
Yeah. We live in a strange time, and I will say this about the whole last couple of years is that it seems like there is an intent to prevent people from finding information out, which is a really weird thing to me, because I've always just been a naturally curious person. This whole podcast is predicated on the idea of sharing ideas and sharing information. Mm-hmm. I'm not saying when you sit across from me or anybody else sits across from me that I believe 100% of something somebody says. Obviously, there's nuance. Obviously, there's differences of opinion. But like the idea that you can't share information and let a listener or a viewer make their own determination of what to do for themselves is something that I can't even really fathom. But here we are, right? And so we'll see if this becomes my first controversial episode. No, and it's okay. Like if I were to be listening to this, or even 5 years ago, say like that's what you talked about, and so that was a problem, I'd be like, what are you talking about? Like I don't even understand it. So let's kind of move into Act 3, and we'll kind of move us on towards the conclusion of this podcast. Kind of tell me where you think the future of what you're doing is going, right? Like you're building out, you said you have 20 advocates right now. You guys are a couple years old. Like you probably got eyes a couple years down the road. What do you think that your business is going to morph into?
Well, I think we're just going to continue taking those calls and listening to what their need is and matching them with an advocate that best fits.
Okay.
That's number one. My focus is always my current clients and my current team of advocates. Mm-hmm. Because when they get stuck on a problem, they'll call me and say, hey, I'm a little bit stuck with this one. What do we do, right? And that's what we do as a team, and I want to continue that momentum because we're going to continue to run into really great options for people, and that's what we need. We need the network to really open up to other alternatives. We need to talk about complementary treatment options, right? So what that means to your audience is we've got the allopathic mindset, which is usually an insurance-driven healthcare model, but we also have alternatives and holistic, right?
And so how do we create, let's say holistic sometimes gets like, oh, that's frou-frou, right? Or like people discredit it. How do we give that nomenclature credibility, right? Like what is it going to take for people to come around to the idea that there's another pathway for treatment and things like that?
Well, we start telling those stories of success.
Okay.
So when we let's talk about cancer for a minute. That's a big one. It costs a lot. It's very scary when somebody gets a cancer diagnosis. And typically when they get that diagnosis, their primary care goes, well, You're going to need to see an oncologist. You need to go get your PET scan. You might need a biopsy. All of these things. And the person just like, I just got diagnosed with cancer.
Yeah.
And they go, okay, doctor.
Yeah.
They go to the oncologist. The oncologist tells them one of the big three. Either they can get it surgically removed, they need chemo, or they need radiation. Those are the big three.
Okay.
But I'm frustrated because I really need the oncologist to also open up the door to other alternatives and a complementary treatment option.
So you're not saying in lieu of, you're just saying complementary to.
We can do partnerships, and we do that. We have naturopathy and functional med type industry that works with oncology groups on a patient need, because the patient says, yes, I want to do some chemo, but I also want to do some alternatives of high dosing IV ascorbic acid. I want to do stuff for my immune system at the same time, because chemo and radiation is toxic to the body. It also takes down the good stuff too, as you're trying to kill whatever's happening on the cellular level, right? Maybe a biopsy isn't a good option for somebody. Maybe the biopsy actually exposes what is happening to increase risk in terms of the lymphatic system, right? I mean, could that cancer spread with the biopsy going in?
Yeah, I don't know.
Those are questions that people are asking.
Should be asking at least,
right? And because usually insurance will say, well, this is what you need to go do next. This is what you need to get done next. Well, I'm saying, do we have to do that? Can we insert these other things? So I really need the insurance industry to also start covering things like IV ascorbic acid, IV glutathione.
I'm sure that's relatively inexpensive, correct?
Yes.
Okay.
These are things that can be done. These are things that can be compounded in a licensed pharmacy. So it's not foo-foo. It's not conspiracy. These are real things people are asking for. I go get this myself.
Yeah. Well, so how do you, if anybody were to listen to this and go, well, I'm in disbelief, or, maybe even try to discredit what you're saying. Like you say, there is data to support this. But what do you think then is the bias against that type of treatment? Is it because it's less invasive and less expensive, or is it because it's not as long standing proven to work, or what do you think some of the motivations are to attack that pathway?
Well, it's because typically when all of us have a healthcare issue, our initial thing is to say, I'm going to go back to my doctor and talk to them. The doctor doesn't know all those other things. The doctor doesn't even talk about nutrition that well. They have like 10 minutes of training. Yeah. And the doctors know that.
Well, I could have an entire podcast dedicated to that problem.
So they also don't know about alternative holistic. And it's not that they're not opposed to it. Oftentimes, they just don't know enough of how to talk about it. Okay. Right? And remember, they're only getting paid 15 minutes for these doctor visits as well. Yeah. That's a problem. Yep. Whatever happened to that patient-physician relationship? And I'm telling you, I know these doctors, they call me, they're frustrated with having to get slammed in their day, having to go see these patients that do need more time and attention, but they got 15 minutes. They got to keep moving. Yeah. They're under a productivity score. I know it. I've seen these. I've seen how they get paid.
Jeez. What a perverse system we've created around primary care, especially. I mean, go back.
So we need a partner, is what I'm saying. Is the primary care doctors? We need to collaborate. We need to go back to collaborating. We need to start asking the bedside nurse, right, questions, because they're talking to that patient a whole lot longer. I'm telling you, my nurse community, they know the right thing for patients. They know what and there is missing pieces. And I'm sorry, some physicians have an ego. They say, this is what I know. And I'm like, I got an ego too. Yeah. But we got to get back down to the patient individualized plan of care.
Well, remember why we're here, right? We're here for the patient. We got to
remember why we're here.
Yeah. And so what's that is it the Hippocratic Oath that first do no harm, right? Or something like to that effect?
Yeah, it sounds like a cute word. Yeah. I mean, it's just not happening the way it should.
Well, that's what I'm saying, is get back, is like, first do no harm, like let's focus on the patient really is the message there, and what's best for them, or even give them actual control over what their decision-making process. So leave me with this if you want closing thoughts or call to action, anybody that's listened here so far, and this has been a lot of fun. What do you want to leave the audience with?
I just want the audience to know you're not alone. You don't have to live in fear about any of your healthcare concerns. Even if you don't even have anything going on with your healthcare, we do a lot of proactive planning. That keeps you out of trouble. Why do we have to react to problems? Yeah. It's so much cheaper, and it's so much better to not to have to fall in the hands of crisis, right? We tend to make bad decisions when we're in crisis too. So I want people to be encouraged. Know that there are other options. We want to provide that information. You are the decision maker of your own healthcare. Sometimes you just might not know all the answers. So let's try to work on that together and develop that plan of care. You know, our tagline is healthcare sucks, get an advocate. And we truly believe it. We're doing something really unique and different. All of our pricing is online, our FAQs online. We're going to get back to you when you actually call. You're not going to have to wait a week to hear from us.
Nice.
We do a really great job of follow-up because we really do care. We, of course, triage the ones that are in hospitals a lot sooner if we do hear that voicemail or if we see that on their enroll now, because those people are in a very critical situation. So we do a great team. Our team's amazing. We've got people that help with appeals, denials, negotiations, have great insurance backgrounds as advocates. We've got nurse backgrounds, pediatrics, adult. We've got naturopathy backgrounds. We've got physical therapy, occupational therapy. These are the components of our team because we don't know what's going to come to us next, but we want to have an answer and a solution for them.
Well, that's the proactive mindset rather than the reactive, right? You're prepared for essentially any scenario that comes your way. Well, I want to just personally say thank you, one, for agreeing to come on the podcast, right? I reached out proactively because you stepped onto my radar and I was like, oh, this sounds really cool and I want to learn more. So you're educating me more than anything during this. But I also want to say thank you for doing what you do. Really, really cool. Love the model. I really appreciate genuinely your sincere passion for what you do as well. So I wish you the best of luck, and hopefully we'll do one of these down the road again soon.
Thank you so much.
My pleasure. True Captive believes in healthcare that is personal and insurance that isn't complicated. Check them out at truecaptive.com.